A person in his 40s, blood spitting from mouth early in the morning. He had long history of acid reflux, and it was just a bit of blood in the saliva when he spat before or after brushing. He has been doing various tests, only found inflammation in the gut. He was given antacids and for few years, and yet the blood in the morning is a common phenomenon, a daily event. Last 6 months, he is on the diet and herbs such as gas gourd, avipattikara churna, triphala, etc. And his recent test shows gut inflammation. He feels energetic. He's not bloated. He feels hungry, but still blood is coming through the mouth early in the morning. How to approach, and what are the different ways we have to look into here in this case, sir?
See, first of all, we need to understand the main complaint of the patient here is bleeding. So we need to observe this, whether it is a clotted blood, what is suggesting, or it is a fresh blood. If it is a fresh blood, then definitely we should go for the color of the blood. Fresh blood color is very much reddish and very clear. Then it is a bleeding from the oral cavity or buccal mucosa or somewhere, or from the gums or something like that. It is not from the stomach. If it is from the stomach, definitely due to the presence of acid over there mixes with the blood, hematocrit is formed and it becomes a coffee brown color. It won't be a reddish color. So such differentiation we should be able to make it to assess whether this bleeding is from the gut or whether it is bleeding from the mouth. So first we need to understand. And you observe here in this case, the bleeding is soon after brushing. Maybe there is a wrong way of brushing. He is rubbing or vigorously over the gums and maybe inducing in bleeding, capillary bleeding, maybe from the bleeding from the gum. It may be spongy gums. So we need to understand all these aspects. Simply from the gut, if the bleeding occurs, then it won't be a fresh blood and it won't be of a reddish color. That we should understand. Of course, a person who is having acidity or hyperacidity or these type of what you call sore erectations and burning sensation, and there is a gut inflammation and all those things, like definitely that stomach guard or whatever that they are giving and containing avipattikara and all those things, definitely they'll do pitta shamana, and the excess pitta, if it is there, then it will be thrown out of the system as some regular bowel cleansing. So definitely it will going to help it. But we need to understand whether that bleeding is from the gums or buccal mucosa, or it is from the stomach. If it is from the stomach, the color will not be fresh reddish. It will be coffee brown. So that differentiation, we should know that.
Even from an Ayurveda perspective, to diagnose this, can the bleeding from gums can also be considered as a form of Urdhva Rakta Pitta itself?
No, that can be considered. If it is, then we need to understand many things. If there is an injury, then bleeding is there, then we should not consider this as a Rakta Pitta. Rakta Pitta is when Dravatva of Pitta is increased, which in turn has increased the volume of blood, and thereby it is oozing out without causing any physical injury done by us from our side. So it is a spontaneous bleeding, then we can take it as Rakta Pitta. But after brushing, if bleeding occurs, then it is not a spontaneous one. It is due to the wrong way of brushing. We need to understand that.